now we are moving to the next block, but before giving the stage to Laura, I'm going to make a question. So I just want you to raise your arm if you haven't heard about open innovation before today. Before today, who hasn't heard about open innovation? Okay, so we are all experts because no one raised the hand. So this is amazing because I don't have to do any further introductions. So this is the second panel. We are opening the block on open innovation. How can corporate institutions, research centers work with startups? So Laura Soto, please come to the stage, and a big applause for her.
Thank you, Alex. I'm pleased the speakers can join me here in the stage directly. So yeah, thank you everyone for being here. I'm really excited to have such an amazing audience, such an amazing speakers. I think it's really important to do this kind of conference to bring everyone together from the health system to discuss interesting topics, important topics. Because at the end, as we've been saying in the other panels, in the startup pitches, collaboration is key to making this global health ecosystem. So yeah, as Alex mentioned, I'm Laura Soto. I'm part of the Health Ventures team at Plug and Play. Really excited to be here and to be discussing this also important topic of open innovation in healthcare. So today, for this half an hour, we will be discussing how corporates and startups, other stakeholders can work together to actually push the boundaries of innovation in health. And for me, and I bet that for many of you, this is really important because what it means is that we are bringing solutions to the patients faster. So I think it's also really beautiful. To begin, I will first ask you to introduce yourselves briefly and maybe say a few words on what open innovation means to you. We can start here with Sofia.
So thank you very much for the introduction. My name is Sofia Nasser, and I am the corporate development lead at Caresyntax. At Caresyntax, we are on a mission to make surgery safer and smarter, and we primarily do that through the collection of data within the operating room. It's a pleasure to be here today, and I'm looking forward to the discussion.
And Sofia, before you pass on the mic, what does open innovation mean to you?
So innovation is really at the heart of what we do at Caresyntax. Over the past decade, we have been building an environment, an ecosystem that connects all the different stakeholders who are interested in surgery, be that the patient themselves, the surgeons, hospital leaders, finance teams, insurers, medtechs, even governments. And for us, innovation it's really important to give these stakeholders access to data to actually see what is happening within the operating room, and then they can use that data to fulfill or look at their own perspectives and fulfill what they would like to achieve with that.
Yeah, thank you. Maybe Eva, now you can introduce yourself.
Hi, I'm Eva Aurín. Sorry. I'm a chemist, but I have never worked as a chemist. All my career, I developed all my career in the technology, and in the healthcare sector, I've been over 17 years, more or less. Now I'm the president of the Catalan Digital Society Care, no sé cómo lo he dicho, Digital Catalan Health Society, sorry. And I'm working in Telefónica, and in my past life, I was the head of innovation at the Barcelona University Hospital. So I know a lot the open innovation in the sector, in the private sector, the public sector is different approach. And in the Digital Catalan Health Society, we think that open innovation is a way to connect the different actors from the sector. People, hospitals, startups, to develop solutions that really fit the necessities of the sector. Because sometimes startups or company develops very incredible solutions, but don't fit the real need that the people have. Mm-hmm. So it's very important that all these people comes together, share their needs, share what is the best option to solve the needs that they have, and so develop the best solution to solve the problem. But I think it's very important to share. It's open.
Yeah.
This is not closed. It's not my problem. It's not my solution. I think it's a question to share what are my needs, and share what is the best solution to solve your need.
Definitely. Thank you.
Thank you. Jorge Fernández, Chief Innovation Director Officer, for Hospital Clinic. Thank you, Sant Pau and Plug and Play for the invitation. And Patricia for suggesting the cough application. I've downloaded it. I'll be coughing a few times today. I'm not feeling well, so I promise I'll do my best, okay? Open innovation for me, I'm not gonna give an academic definition, but is doing something of value with others that you might consider in the past that are more competitors than collaborators. I prefer the term collaborative innovation, but I think the idea is that you work with others that in the past you maybe didn't think that you were working with, let's say. For example, we do a lot of sharing of knowledge with Sant Pau, with Vall d'Hebron and others, because I think it's important that the top hospitals in Barcelona, but in the world, share what they're learning together so we can move the needle faster. So I think it's a matter of working together, building on what you said, to move things faster.
Definitely. No, thank you so much for these initial words. So I've written down collaboration, data sharing, connecting, covering needs that probably many patients have. And I fully agree with what you've just said. But I mean, with all of this, it's amazing. However, there are also challenges to this, right? Actually, healthcare, if you're looking into the graphs of adoption that are publishing reports, you might see that the health industry is not always or barely sometimes the first. So, of course, we are working towards open innovation and collaboration, but oftentimes we're not getting there in terms of adoption. So maybe I can start with Eva. Why do you think healthcare industry is not there yet, or where do you see the challenges?
I think it exists a lot of things. It's not only one question. And it's not only a question of regulation, because, for example, banking have a lot of regulation, but they go faster than us. I think it's a question that, for example, in this kind of industries, people are more used to adopt innovation. It's easier. But in healthcare, when we do a change, it's not a question of put a new technology. It's to change the way that we are working now. So this is not easy. Yeah. Because if we put only a technology, we don't change the way to work. And the problem now is the way we work. Yeah. Sorry, because we are not efficiency. The sector nowadays is totally inefficiency, and we need to change. And the technology is a tool that helps us to do this change in the way we are working. So this is a big problem. Also, another problem is, as I commented, that perhaps startups or company develops a very, very incredible solutions, but doesn't fit the problem that the real problem that they need the problem that the professional have. So we have to co-create. Yeah. We have to co-create professionals, patients, startups, other industry to develop the real solution for the real unmet need. Another problem, of course, is the regulation. It's very strong, but it's necessary because we have working with data, sensitive data, and it's very important, this regulation. And it exists more things, but I know if I have time to explain all the problems that we have now, it's easier in entertainment, in banking, of course, but I think it's more exciting in healthcare, because when we do a change, the impact is very incredible in people. I think it's very interesting.
Yeah, when you're covering a real need, then it sticks, and then you can see an actual outcome.
Directly in the person.
Definitely. No, I mean, that's really wise. And of course, we cannot leave aside regulation because it's always there, especially in this highly regulated industry. But yeah, I fully agree. And maybe I go into Jorge, because I know that you're part of this European AI Society. So basically what I've read online is that with this kind of association, you want to foster this collaboration, foster the understanding of the needs, regulations. And I think that's actually probably a key to actually move from these challenges into the actual implementation. So what do you feel that these kind of societies, organizations are bringing to the table, and where do you think the key is to actually move from maybe these initial ideas into actual implementation?
So let me answer in two ways. Okay, one is to add to what Eva said without repeating myself. I think one thing that Eva didn't mention is we need to change the mindset of ourselves. Yeah. Okay, I think that's the biggest change to do open innovation. It doesn't start with patients, it starts with top management in different institutions thinking of opening up to work with others that traditionally are not the people that you were working for or with. So that's one thing. So that's part of why a group of friends, we decided to do this at the European level to try to put our, let's say, our little effort into try to connect people that usually work in silos, let's say the BC funds, the European Commission from Brussels, hospitals, pharma companies, etc., to try to see if together we can go faster, let's say, which is, I think, the challenge, let's say. But first, the mindset shift.
Yeah, and actually on that point, and I will stay with you, what do you think is key within your organization? For example, you are a decision maker within the hospital clinic in this area. What do you think is key to change internally to be able to be open to innovation?
That's the easy question of the day. I get it. I think I think the most important thing is to try to find the people in your organization that thinks like you, in the sense of what do you want to do in the future. I think that's the most important thing. Let's say, I'm not going to call them friends, but let's say the like-minded people who want to play along the same lines. Organizations like hospitals are huge, and we have everything inside, okay? From the super smart and top collaborative people to the super smart non-collaborative to anything in between, let's say. So I think the best way to start is to find people who think like you and who have a desire to change things and move things forward. That's the first. Then you go into plans, what's the first thing to do, priorities, and a lot of different things. But I think is you need to assemble the right people in the room. Once you have the right people, I think it's easier to convince top management if they are not convinced already. Okay, some top management are very difficult to convince. Okay, I might say I'm on the good side here. I've always been on the good side here, but I am aware that there are some that are very difficult to convince, and Eva also knows that as well.
Yeah. Well, if you want to comment on this, Eva.
No, I totally agree with you. I think it's very important to convince the management. It's the key. Have a strategy. I think it's important to have a strategy, not put only one innovation on two innovation. I think you need a total strategy to understand this is a question of digital transformation, and it's not only a piece. You need to change all the way that we are working now. And this is not only a piece because it's a pilot, and the pilotitis is a very bad because we don't have this strategy. I think it's very important.
Yeah. And well, maybe I will jump to you, Sofia, because you are on the other side of the table. You've probably met corporates that are really aware of innovation, some others that might not be that comfortable with innovation, because at Caresyntax, they bring together many stakeholders. So you work with insurance companies, with corporates, startups, medical device, etc. So yeah, maybe what's your take on this? What do you see in these organizations that maybe make your life a bit easier versus no? And yeah, where do you think it's the key to enter to this or in the conversations with these corporates?
So, as you've rightly pointed out, there's a lot of different stakeholders involved that we interact with at Caresyntax. What we found really important is thinking about each individual stakeholder and what they care about. If we're thinking about the patient, the person having the surgery, they just want the best possible outcome. If you're thinking about the surgeons, they also want the best possible outcome, but they're also thinking about efficiencies in the top line, for example. Insurers, they're thinking about risk management, and the list goes on and on and on. And I used to work in investment banking, so I came across a lot of digital health companies which had brilliant models, but there was no proper business model, and that makes it really difficult to have a sustainable business that's able to scale. The way we've been able to achieve this at Caresyntax, and we've been working on this for over the past decade, so it definitely isn't an easy journey, but I think we're at that point that we've cracked it, is when we talk about improving surgical outcomes, we don't just mean about doing it in one way, but we look at it from a clinical, operational, and a financial perspective. And by thinking about this holistic approach, we're really able to connect with a lot of different stakeholders. So I think that's really one of the difficult things is you have a product, but then being able to connect with all the important decision makers. And you know, talking about selling into corporates or selling into hospitals, it is extremely hard. So it is really important to have the right connections, and that is actually what Plug and Play has helped us with in the past, introducing us to the right people and really enabling us to have that internal champion who is driving the process forward. So it's definitely not easy, but it is possible with a lot of work.
And just a follow-up question to you, because you're talking that it's extremely difficult sometimes to partner with some of these corporates. Once you have established this connection with, let's say, a hospital, and this goes on the same level as Eva was saying on the pilotitis, how do you actually go from piloting to sticking there? Have you identified any precise keys that you can tell us today?
I think the key is really going from proof of concept and having an idea to moving to proof of value. So we really noticed when we expanded in the US back in 2021, wasn't really the best time during the pandemic, but a lot of these hospitals are looking for tangible metrics. It's not enough to say, we have an idea, this is what we're wanting to do. You have to actually show that the solution is having some sort of impact, and there really is an ROI. Otherwise, there's no point in really having it. When we first started Caresyntax over a decade ago, our founders had a vision. However, the artificial intelligence wasn't really there back in 2012, but we knew at some point it would be there. So we really focused on moving from this proof of concept, installing in as many operating rooms as we could, and now we're in over 4,200 globally. And then over the past few years, there really has been a shift, and we've gone from analyzing data retrospectively to actually impact the outcomes. So when we go and do a pilot in a hospital, they're actually able to see the tangible impact that the Caresyntax platform can have on surgical outcomes.
Yeah, I mean, it's, as you were saying, kind of identify from the beginning these KPIs and then monitor the return on investment is the key to actually be able to just stick with the corporate. And actually, I know that piloting is really important. Of course, that's what open innovation is, but I would like to as well touch base on pilot and buying versus building, because I think sometimes there is not the need to just go outside. You can also stay inside. And it's really key to identify when to do that, which is something that might as well be a challenge. And I know that in hospital clinic, you also have spin-offs. You also do this build. So yeah, could you give us your thoughts on where to partner versus where to build, how you identify these areas?
In general. Right?
In general.
Not in AI, but in general.
Not in AI, yeah.
Yes? Okay,
Yeah.
now it works, yes. So in general.
Yeah.
So I think it's very acute. So I think this is a very important question, and digital and in AI specifically, okay? In things that are heavily regulated these days, where hospitals cannot afford to have 15 algorithms developed by their physicians that need to be regulated later, and because we don't have the cash. I mean, if you're Mayo Clinic or Cleveland Clinic, fine, but if you're a regular hospital, a top regular hospital in Europe, you just cannot afford to pay for it, right? So for these things, my strategy is always to buy. Right? Buy is difficult, okay? Because you get approached by lots of startups who are not regulated, and we are forced to say no, thank you, unless we want to develop something because it's very interesting for us. With them, we could develop sometimes. The other difficulty is sometimes is everybody knows, and I need to say it. When things are regulated, they don't work equally well. In your clinical setting, and that's something that everybody knows, that you need to test it in your setting and just make sure that it works, right, with your own physicians, your own data, your reality, let's say, right? So that's one thing. When do you build yourself or lead or name it as you want? I think is when it's very strategic for you, right? For example, in our case, it is very strategic advanced therapies these days, right? So basically, we build things there, okay? But for other things where it's less strategic, we will decide to buy. And sometimes we can decide to partner with others to understand things or to build things together. Usually less is more with, in the past we probably will try, we have tried to do things with pharma companies, medtech companies. I think these days it's more complicated. And now we partner more with other hospitals or with other actors, let's say, that we can move things faster. So it's not an easy answer, but I don't like that.
And why would you say it's easier to partner with hospitals? Just throwing the question here. Why do you think it moves faster than with pharma, for example?
I mean, because when I talk to Mar or to Patricia, they have the same problems as we do, let's say. And
basically, their needs.
Their teams, my teams, other teams, they have the same problems. And there is no problem in sharing our problems because there is trust. No, I'm not going to say outside what's the problems at Sant Pau or at Vall-d'Hebron, and they are not going to say outside what are the problems at clinic, right? We use the problems to try to grow together, learn together, make decisions together if possible, let's say. So I think this is why it makes sense for certain things. Will we ever build a solution, let's say, that is not government-based, but is, let's say, public hospitals taking the lead? Well, maybe. Up until now, we haven't, let's say. But maybe in the future, there is something that makes sense. I don't know, let's say. But at least in a level, it's easier for us to collaborate. At least that's my opinion. Maybe they have a different one, but that's my opinion.
Yeah. I mean, it's true that probably the needs are more aligned. I also think that at the same time, we do need these societies, these associations that bring everyone together. Because especially when you're partnered with solutions that are, for example, for a hospital or for patients, you need to involve insurance as well. You need to involve everyone because otherwise the startups per se might not be able to scale and then on and on. But yeah, thank you so much for your insights. And I want to be mindful of the time. So maybe I will just go into the present and the future. So we've been seeing many applications that are right now really sticky, AI scribes, admin, while others are just getting there, and a lot of them with AI focus. And many of these solutions actually need a lot of data. That's something that you were mentioning before. Sofia, you also mentioned about data. How do you see this data evolving, Sofia, in the sense of privacy versus collaboration versus including the patients? Because it's sometimes a bit hard to just figure out how this will evolve. But I think you have good insights on that because you are working with this data on a daily basis.
Yeah, definitely. So the data that we have access to is, of course, de-identified. It's very important to comply with all of the regulations. I think thinking about now and how far we've come, many, many years ago, if we wanted to create an AI solution, for example, we would need to start by building the algorithms from scratch. And then we would finally, once that's done, after many weeks, if not months, if not years in some cases, then we can put the data and feed it through the infrastructure. These days, especially in the past few years, something that we're really excited about at Caresyntax is the fact that the infrastructure is already in place. So that's where the people who have this proprietary data, that is really the key. We're seeing a lot of AI solutions, for example, being commoditized. So for us, the key is really having some sort of proprietary data. And of course, we're supportive of open innovation, but it's important to think about the partners that you're working with, and like I mentioned before, the safety aspect and how, who that is coming in contact with and how it's being used in the appropriate ways.
Yeah, and also adding on top of that, from my investor perspective, of course, we value a lot the data sharing, but it's true that a startup that has this proprietary data that they can use is really powerful, even though data is on silos and it's hard to get. So if they have even more data, it's even better. So definitely agree with what you've just said. And just to finalize this panel, first, thank you so much for those insights. I want to get your thoughts on which technologies do you see that are leading nowadays in terms of implementation in healthcare settings, and how do you see this evolving? Which technologies do you think are, in the next 5 years, going to take the lead? Maybe we can start here, Sofia, and go to Jorge.
Put me on the spot.
Or whomever wants to start.
Artificial intelligence, of course, is the best. No, I think that in the two sides, because now we have the generative artificial intelligence that help us with repetitive tasks, simple tasks, as for example writing a report when the doctor is with the patient, and in the other side to support in the diagnostics. It's because artificial intelligence is a very good tool to find patterns, and it's a way to help the professional to detect earlier some problems that the patient have. Yeah. I think these parts, the two, the generative artificial intelligence for administrative processes, and in the other side, with this support of the diagnostics and to thinking about the personalized medicine, is a tool that is needed to do this kind of medicine.
Yeah, and hopefully it gets to the patient in the next years at a wider level. Do you agree, Jorge, with what she just said?
Okay.
We'll go after. It's fine.
So on the clinical side, I would say anything that has to do with precision, either in diagnostics or in therapies, advanced therapies for sure, because as a technology is incredible, the success rate they have. That's the first thing. And then, of course, in terms of AI, I think AI is, now we're seeing a big thing on scribes and these things. I think this will be a commodity down the line, and I don't expect anything big happening there. I'm hopeful of anything that saves time and money of, let's say, people, patients, anything, let's say. And there, I hope that this agentic AI that is coming really works. It's just an hope, because I don't know enough to make any further statements. But I think that the data we have might put us in a difficult situation to try to gather this future. So I think, yes, we have a lot of data, but the quality of the data, well, let's see, first thing. And then the second is we might have a lot of data in some places, but some hospitals that I talk to, they find it very difficult to get their own data from their own systems to do certain things, right? And that's complex because unless we have that, we won't be able to do anything that is precision related, let's say.
Yeah, we need interoperability and being able to access the data even within the same center. Any last words you want to add?
I mean, everything we do at Caresyntax is centric or centered around AI. Just going on from Jorge's point about agentic AI, that's something that we're super excited about. And like I mentioned before, when we first started, we would spend a lot of time just building this infrastructure, whereas now we can focus on using agentic AI to help us bring various different solutions to our platform and to the different users. So it's definitely helping speed things up for us.
Yeah, it's starting to be the present and the future as well. So thank you so much for joining us today, and thank you so much for the insights. I think we had a really nice conversation, so thank you. An applause for the speakers.